Okay, so welcome back to Genius Class 2023. Let's share the screen and then we're going to start. Let's have a look. Okay, good. So Genius Class 2023. Our next task is a uterine fibroid. Uterine fibroid. In this particular case, when FY2 in a GP surgery, a 40-year-old woman has made an appointment via a video call. Okay. She had an ultrasound scan done, which showed the two fibroids, 17 centimeters anteriorly and 14 centimeters lateral posterior side. All the investigations were done and were normal. Okay, so she has made a follow-up appointment via video call 2 weeks ago, had presented with heavy menstrual periods. And she has had a heavy menstrual period for the last 4 years. Her periods last about 6 to 7 days and she does pass clothes. She has got no children. Questions. What are you going to do for me, doctor? Is it a must to have a surgery? What are you going to do for me, doctor? Is it a must to have a surgery? Approach the task. Grips. Here we need to outline our approach properly. Okay, so it's better to actually take a history and then explain the investigation, then discuss management. History, explain the results, and discuss the diagnosis and the management. So in the grips, our introduction, we're going to say, I understand that you had an ultrasound scan done 2 weeks ago or 1 week ago, depending on the time frame. Yes, doctor. Okay. Now, we do have the results of your scan. Is it okay if I can ask you some questions about your general health? And then we will go through the results of your scan. Is that okay with you? Yes. We are trying to outline that first of all, ask some questions, then we discuss the results. If we don't do that, patient will be asking, what about my results? What about my results? So we're telling them how the consultation flow would go. Some questions, and then we'll go through your results. Okay, good. Then you're going to take the history. Can I ask you, is there any particular reason why you had the scan done in the first place? Because you had heavy menstrual periods. Then you enter into menstrual history. As usual, how many days do you bleed? Are your periods regular? How many days is your menstrual cycle? Are your periods heavy? Do you pass clothes? Okay. And this particular patient, okay, bleeds 6 to 7 days. Menstrual periods, are irregular. So cannot say how many days is a high menstrual periods. Yeah, good. Ask about pregnancies. Okay. Do you have any children? Have you been pregnant before? She has got no children and has not been pregnant before. Okay. So this slide was not clear. So no children and no pregnancies before. Symptoms of fibroid. Ask about any pelvic pain, any abdominal pain or discomfort, any bloating, any back pain. Other urinary symptoms. Asking about any frequency, any agency, any urinary incontinence, any urinary retention. Ask about the bowel symptoms, bloating, any constipation, any painful defecation. Ask about subfertility and infertility. Do you have any children? Have you ever been pregnant? Have you ever tried to be pregnant before? Pressure symptoms, low abdominal discomfort or heaviness. Then complete the rest of the history. The PMAFTOSA, ICE, effects of symptoms. And in your history, it's important to ask about screening for cervical cancer. Okay, when is the last time you were screened for cervical cancer? And ask about the family history of fibroid. Anyone in your family has ever had a condition such as fibroid or any medical conditions. Examinations. Okay. You need an abdominal examination and a pelvic examination, which in this particular case, you'll be given the findings. And since you have done the examination, now is to explain the results. So explain that the results show that you have got a fibroid, okay? And in particular, she has got two fibroids, okay? They are quite big, 17 centimeters and 14 centimeters. Now, generally fibroid, okay, are benign tumors. Fibroids are benign tumors, which is caused by proliferation or overgrowth of the smooth muscles, yeah, a mixture of smooth muscles and fibroblasts. That is an overgrowth of smooth muscles and fibroblasts, which form a hard, round tumor, or which form hard, round tumors in the myometrium or in the muscles of the uterus. So this is an overgrowth of the muscles and the cells called the fibroblast cells. Okay, they overgrow and they form a hard, round tumor in the muscles of the womb, uterus or womb. They can be single. They could be multiple, and in your situation, you've got two fibroids. Typically, fibroids, they do develop in women of reproductive age. Okay, so before menopause, they typically develop before menopause. Now, in terms of management, what are you going to do for me, doctor? We'll refer to the gynecologist. Okay, so if somebody's got a fibroid measuring 3 centimeters or more, then we refer to the gynecologist. Offer the leaflet about the fibroid so you can read up more. Treatment of fibroid is only required if symptomatic. She is symptomatic because she has got a heavy period. So this particular patient needs treatment because they're giving you heavy periods. Okay, explain what the specialist would do. There are many treatment options. First of all, for the heavy menstrual periods or menorrhagia, medication like NSAIDs, such as ibuprofen, they can reduce menstrual blood loss. Another type of medication called tranexamic acid, that is antifibrinolytic. So tranexamic acid may also reduce menorrhagia. Okay, so just this is it, menorrhagia. So there's some medical treatment that can help with the heavy periods, such as ibuprofen, NSAIDs, or tranexamic acid, or some hormones, such as combined contraceptive pills. They can reduce the heavy menstrual period. But Mirena is more effective at reducing heavy menstrual period, as long as there's no distortion of the uterus. Other drug treatment here is a Mirena, a coil called Mirena. Okay, good. It's very good at controlling heavy menstrual period. It is effective at reducing. So let's do this so that you can see properly. Okay. Good. So it's effective at reducing blood loss. Now, gonadotrophin releasing hormones, agonist, they can also be used. So let me do this so you can see that this is a main treatment here. Good. And this one in here as well. You can see that. Good. So what we're trying to say on this slide is that a Mirena coil, levonorgestrel releasing intrauterine system, is effective at reducing blood loss. The gonadotrophin releasing hormone agonist, they produce a reduction in the size of the fibroid. The size of the fibroid does reduce if you treat with the gonadotrophin. But once this medication is stopped, the fibroid regrows again. The fibroid regrows. Okay? So that's the problem. But it can reduce the size, but the fibroid will grow as soon as you stop the medication. So there's a medication that can reduce the size of the fibroid. These other medications can reduce the heavy menstrual period. This one is to reduce the fibroid. They are also surgical, so it's not a must to have a surgical treatment because some other medication that can reduce the fibroid and can stop the heavy menstrual period. Then there is surgical treatment. First of all, what are the indications? Okay, fibroid is submucous and fertility is reduced. Is she struggling to have children? Has she tried? Then surgical treatment is indicated. Excessive enlarged uterine size. Okay, medical treatment is not sufficient to control the symptoms. That's why we can try medical treatment. First of all, if the symptoms are not controlled, then you go for surgery. Pressure symptoms are present, lower abdominal discomfort and heaviness. These are pressure symptoms. Surgical is indicated. So it's important when you take the history to ask about these symptoms. But still, the patient has to choose the option. So surgical options include interventional radiology procedures. We are talking about uterine artery embolization. Okay, there is uterine artery embolization offered if a woman who wants to avoid surgery. Okay, who does not want surgery, doesn't want surgery, big surgeries, So we can do a uterine artery embolization if they don't want the big surgeries, It's a surgical option, but it's not a surgery, it's not an operation, okay? So surgical options include mammectomy. This is removal of the fibroid, or hysterectomy, removal of the whole uterus, of the whole womb. If you're trying to avoid these options, then you can do uterine artery embolization. It's also a surgical option, but there is medical options as well. Now, this particular patient has menorrhagia, needs treatment options to treat the menorrhagia, but she's not very keen for operation, so can be offered uterine artery embolization, okay, which is a radiological intervention, not an open surgery, to remove the fibroid or to remove the uterus. She wants to keep her uterus, so the uterine artery embolization may be appropriate, but still the patient has to choose. Mammectomy options should also be explained, but they are surgery, so this is why we can offer medical treatment, such as gonadotrophin will reduce the size, but you have to take the medications constantly because we said if you stop, then the fibroids will regrow again. Okay, menorrhagia can be handled with a Mirena coil, can be handled with contraceptive pills or NSAIDs. In terms of surgical treatment, there is of course these ones as discussed. Uterine artery embolization, that is of course trying to cause obliteration of the blood vessels. Okay, in other words, to kill the blood vessels that goes to the fibroid, so the fibroid can die. And the surgical ones involve mammectomy, removing the fibroid itself, or hysterectomy, removing the whole uterus. This particular patient will refer to the gynecologist. They will go through the whole options in more detail and explaining and the advantages and disadvantages. The specialist, if surgical treatment is indicated, the specialist might need to do biopsy in order to confirm the cytologically it is a fibroid, not any other tumors. If any operations or surgical treatment they are indicated, they may want to do a biopsy. Okay, thank you.